We are providing voice feminization therapy and voice feminization surgery in our institution. In our multidisciplinary team, we provide everything that is needed for voice feminization. That includes surgical procedures, logopedics, but also vocal coaching. We do that in a setting where we have a pre-operative examination and assessment of the female patient. Then, after we are convinced and the ladies are convinced that they want to proceed with us, then we do the operation, which is in general anesthesia, and I will talk about that in a second. And after that, we provide 10 sessions of post-operative voice care and voice feminization. And why do I say voice care and voice feminization? It is very different from other disorders and diseases of the larynx, because voice feminization is a healthy larynx, a healthy person who wants something not only to be corrected on the voice pitch, so if it's a higher or lower tone, but they also want a social cultural adaptation. They want to sound feminine. And that is much more than only the pitch. It is the way we call prosody, so it's the way how you act feminine. The surgery itself is nowadays, of course we have many kinds of techniques, but nowadays I think worldwide the best method is to suture the vocal folds. Now within suturing of the vocal folds we have different techniques. Our technique that we use routinely and has really showed that it has very good results is that we suture the vocal folds in the frontal third to half of the vocal fold. After the sutures are put there with a permanent thread, we also inject something on the lateral side of the vocal folds to squeeze them, and when we squeeze them, that means that they can heal. Now the squeezing filler, that stays for approximately a couple of weeks, and then this part of the vocal folds can heal together, the filler resolves, and then after that the suture is permanent and is robust. After the operation we have to make sure that the vocal folds, when they separate, which is during breathing, that these vocal folds do not tear the little suture. Now, if you do it with a good technique, that suture will hold. But still, we advise the patients after the operation not to forcefully abduct, to take apart the vocal folds, which means they should not cough, they should not throat clear, they should not laugh or sneeze loud. All of these four things, coughing, throat clearing, laughing, sneezing, makes vocal folds open very quickly, and that gives a tear and shear stress on the vocal fold. Now, but what can the patients do? They can eat everything they want, they can drink everything they want, they can do sports if the sports are not associated with very quick breathing movements. And we allow all our patients to whisper, and to whisper very softly and only softly. So they can whisper like this, they can talk like that, which is a tremendous help for our patients, because then they can communicate and they can tell all of their friends, listen, this is how I feel, this is how the operation was, this is my needs. So many patients that if they have to write everything, it is really a drag. So whispering is allowed. They're not allowed to whisper like that with a tone. So tonal whisper, not allowed. Soft, soft whisper is allowed. Now, one of the most frequent questions we get is, how can I post-operatively avoid coughing, throat clearing, sneezing, laughing? Let's go to the coughing. Now, if I have an urge that I'm coughing, then coughing means you inhale, you close the larynx, your vocal folds, and then suddenly you expel the air, like, ah! So if you have the urge that you have to cough, you first exhale like, and after that I can't cough. Because coughing without air is not harmful. It is the air explosion that is really harmful for the vocal folds. The same is true for throat clearing. If I throat clear like like that, this is harming my vocal folds. But if I exhale, I cannot really throat clear. But it's even better to try to suppress everything that elicits coughing and throat clearing. So what can I do? I can, when I have that tickling feeling, I think there is some mucus, I can also drink something, water, without fizzy water, so still water. Or if I have the feeling that there is some mucus, I can softly do like that. And if I hiss the air out and no secretions come out, that means that there are no secretions. And if there are no secretions, there's no need to throat clear. Now laughing, loud laughing, is elicited by funny situations. So I rather not go into funny movies and watch funny movies or talk about jokes with my friends. So if I avoid that. Sneezing is something, if sneezing is associated with allergies, then I better take some anti-allergic medication.